Graduated driver's licensing programs slowly introduce teens into full license privileges. Each state has its own guidelines for GDL programs. However, three main stages are followed in each state. Supervised learning period. After passing a qualifying test, a teen is granted a learner's permit. The novice driver can drive only with a supervising adult for a specific amount of time. Intermediate license. The driver has earned a license and no longer needs an adult supervision. However, the driver is restricted from nighttime driving, no cell phone use, and no passengers in the car. Each state has its own restrictions. Lastly, full privilege license. Drivers meet the age and other requirements to earn unrestricted license. Restrictions in age do vary from each state. In this presentation, we are focusing on the graduated licensing program enacted in Massachusetts and focusing on its impact on lessening teen motor vehicle accidents. Driver's education requirements include 30 hours of classroom instruction and 18 total hours of motor vehicle on-road instruction. Parent or guardian must participate in 2 hours of driver's education curriculum. The teen must complete 40 hours of supervised driving by a parent or guardian. Teens must adhere to a curfew. They may not drive from 12:30 a.m. to 5 a.m. in the morning. There are no driving for non-full privilege license holders. Any suspension of a learner's permit or intermediate license will start a run and new suspended license is lifted. So, who is most affected by GDL programs? Teens who are applying for a driver's license, parents who have teens of driving age and are affected by the strict guidelines and must adhere to class schedules and regulations, the community who is affected, hopefully in a positive way, and will see a reduction in vehicle accidents and fatalities, and the state government, who has enacted these guidelines and are responsible for the follow-up on the effectiveness of the program. Lastly, the car and health insurance companies, who will hopefully see a decrease in money spent on vehicle crashes. The goals of the GDL program are morally right in ways of saving lives and building a stronger community. This is accomplished by lowering the rates of motor vehicle crashes and hopefully greatly reducing the number of injuries and fatalities among drivers between the ages of 16 and 20 years of age. Reduce crash costs such as property damage, hospital bills, insurance claims, and court settlements. Build a new generation of responsible drivers with the help of the government, education, and community. Can a graduated licensing program truly improve the way teens drive? The answer is yes. However, there are determinants of health and social factors that can hinder the success of the program. Intrapersonal factor, views, knowledge, and attitude, and skill. Interpersonal factor, influences from family, friends, and colleagues. Institutional factor, mostly comes from schools and other organizations. Community factor, churches, social organizations, and clubs. Public policy factor, government regulations and limitations on behavior. Another issue that may hinder the success of a GDL program are the diverse perspectives of teens and their parents. Some teens may feel they are mature enough to have a full privilege license at age 16. Some teens may feel the restrictions encroach on their rights to drive at night. Some teens may feel their views are disrespected and have no way to voice their opinion. This also affects parents who may feel they do not have the time to take the 2-hour class or accomplish 30 hours of supervised driving. Hopefully, a well-planned GDL program like the one in Massachusetts takes these different perspectives into account. The one factor that makes GDL programs successful is the parental support and guidance to encourage their teens to take responsibility of their driving career. First, the GDL must make this program appealing to parents by making the mandatory 2-hour parental class accessible to work around a caregiver's busy schedule. The 30-hour supervised driving portion can be done with less than an hour a week for 6 months. Community guidance from schools is also helpful for a young driver to get involved in their driver training by offering school driving classes. GDL programs can strengthen a community by introducing young responsible drivers into the community and teach them how to become model commuters. This in turn will reduce motor vehicle accidents and strengthen community ties with teens and their parents. Our federal government has the responsibility to protect the health of the American people. This is accomplished by law. Public health laws are regulated through federal, state, and local levels and are passed as charters through our judicial branch of government. All three branches of government, legislative, judicial, and executive, are involved in every lawmaking process. The Graduated Driver Licensing Program started as a charter and was the brainchild of 3 U.S. senators: Senator Kirsten Gillibrand of New York, Amy Klobuchar of Minnesota, and Chris Dodd of Connecticut. Due to community outcry, in 2010, 3 senators introduced legislation that offers grants to states that participate in a graduated driving program. This legislation also proposed a penalty for states that do not participate. This proposed legislation was supported by crucial data collected from physicians and epidemiologists who collected accident statistics from various state and national data collections. Community resources that were used were public opinion, local and state representatives from the health department, and private agencies. For the purpose of this study that drove the effectiveness of GDL programs, reporting systems such as Fatality Analysis and Reporting System, the Missouri Census Data Center, and the Massachusetts Department of Transportation Registry of Motor Vehicle Crashes were used in the data collection. Funding for GDL programs are made possible by federal legislation and through the guidelines set by the Safe Teen and Novice Driver Uniform Protection Act. The one particular guideline is withholding of highway funds from those states who do not enact a GDL program. The group that would feel the most impact from this legislation would be novice drivers between the ages of 16 and 20 years of age. This is the target population that needs a comprehensive driving program. The parents, who are now required to be involved in the training and curriculum of their teenage driver, and the community, who will greatly benefit from the lower accident rates of their young citizens. And lastly, the insurance companies would be impacted by reducing the number of accident claims and reducing the amount of funds spent on vehicle replacement and or repair. Not to mention the life and health insurance companies that can see a reduction in life insurance payments and health insurance bills. Any type of public policy program can be met with some type of resistance. Americans simply do not like being told what to do or how to do it. Graduated licensing programs have been met with such resistance. GDL programs have a negative economic impact by increasing state taxes to fund for novice driver licensing programs. Even though GDL programs do receive federal highway funds, the public taxpayer pays for the remainder of the funding. Those individuals who do not have children may feel their tax dollars are going to waste on teen drivers. Libertarian views also affect the implementation of a public policy. Parents of teens may feel restriction on their freedom to choose which driving experience and education they want their child to have. This response is typical, especially when a parent feels that their parenting rights are being infringed upon by the government. Moral views such as religious beliefs can also hinder the success of a government program. Some families and communities may feel their religious beliefs are not being respected by the state government. Historically, public health is tied to social reform, such as a need for child labor laws, public housing, and sanitation services. There was also a social outcry from parents and community to have a graduated licensing program implemented in their state. The numbers of teens who were involved in motor vehicle accidents and those who even lost their lives was devastating enough that the parents sought change. Economically, the states knew they needed a monetary assistance from the federal government, or at least an incentive to establish and enact a GDL program. The federal government, along with a few senators, created a solution that worked for everyone. Politically, the bill was proposed by Democratic senators from blue states. Historically, the Democratic Party tends to spend more federal money on public health programs than the Republican Party. However, since its initial creation, all 50 states have some sort of GDL program that is federally recognized. Since the early 1990s, GDL programs have been enacted in all 50 states, but getting states to adopt these often costly programs was not an easy feat. Pediatricians, family physicians, parents, and legislators partnered to get these programs funded and widely accepted. These key players used strategic marketing plan to get their word out to their states. They presented teen vehicle accident and death rates to parents, communities, and teenagers. They spoke of monetary benefits of enacting GDL programs within their state. Parents and communities were urged to take comfort in knowing that their son or daughter were safe behind a wheel of a car due to having a completed GDL program. Marketing materials and how to sign up materials have been mailed out to parents or handed out at schools for increased awareness. Graduated licensing programs have been successful due to their ease of use for the basic consumer. Comprehensive GDL programs that are most successful incorporate 3 months of waiting time in the intermediate stage of the licensing steps. Nighttime driving restrictions, such as curfews after 11 p.m., have reduced the number of accidents. The involvement of parental support by having parents complete 30 hours of supervising their teens' driving has also reduced the number of accidents. Some states have gone as far as restricting passengers in a teen's car until a specific age or a specific time period has passed. Statistics have shown that enacting a GDL program has reduced teen accidents and fatalities by 20% in one age group. Some people have argued that the government should not be micromanaging a parent's control over their teen. Some teenagers feel that they're mature enough to handle a vehicle no matter what time of the day it is or what distractions may come up. The federal and state local governments feel the need to intervene and try to reduce the number of teen accidents. It is statistically proven that comprehensive graduated licensing program has directly impacted the reduction of teen motor vehicle accidents. GDO programs have provided the strongest evidence of scalability. This program's beginning started at a federal level and has been adopted by each state's Department of Motor Vehicles. GDO programs have impacted counties, cities, towns, and their communities. The scalability of this program has even positively affected families and the individuals by keeping people safe. The implementation of graduated licensing programs has saved lives and has improved the quality of life for families and communities.